When you go to the eye doctor, you may not be getting fully checked for glaucoma. So today we're gonna get into the 8 glaucoma tests that every person should know about. Now, not all of these tests need to be done on the same day, but it is really important that at some point you get fully evaluated for glaucoma. And if you are at risk for glaucoma or you already have glaucoma, then almost each and every single one of these tests is going to be important for you. So the first of the 8 tests that we're going to talk about today is eye pressure. Most of you guys have heard about this, and of course when you go into the eye doctor, it is pretty common to get your eye pressure checked. What you may not know is that eye pressure by itself cannot really determine whether you have glaucoma or not. Now, of course, if your eye pressure is high, certainly you will need to be brought back for other testing. But what's tricky is that even if your eye pressure is normal, you can still have glaucoma. So this is why it's so important to do some of the other tests that we're going to talk about, because high pressure alone does not mean that you have glaucoma, and normal eye pressure alone does not mean that you don't have glaucoma. So normal eye pressure ranges from 10 to 21, but like I said, even people with normal pressures can have something called normotension glaucoma. And this is when the second test comes in, and it's very important. So the second test for glaucoma is the optic nerve exam, which is also called fundoscopy. Now, during the optic nerve exam, the eye doctor is going to check for the appearance of the optic nerve and to make sure that there is no cupping. This is when the center of the nerve appears more hollowed out and it doesn't appear to have really healthy rim tissue around it. In fact, a normal optic nerve with a small central cup will kind of look like a donut. I often tell my patients that sometimes in glaucoma, it can look like someone has kind of eaten out the center of the donut and there's just like a raggedy little rim that remains. So if I see that on exam, or if I see something that looks like it might be headed in that direction, it's not just about eye pressure. It's combining the appearance of the optic nerve with the eye pressure. And in terms of eye pressure, the third most important test for glaucoma is something called corneal thickness or corneal pachymetry. This is an important measurement because it helps glaucoma doctors like myself actually qualify the pressure reading. So for example, if someone has a really thick cornea and their pressures are in the low 20s or mid 20s, it may not be as concerning as someone who has a pressure that's 17 or 18, but with a very thin cornea. Thin corneas in and of themselves have a higher risk of developing glaucoma, so we typically check corneal thickness on every patient. Now, like I said, it may not be something that needs to be done on your first visit to the eye doctor, but through the first few visits, if you're being evaluated for glaucoma, corneal thickness is something we are going to check. Corneal thickness is typically only checked one time in an office, but if you switch offices, then they may need to check it again. Now, one test that is not done just one time, which many of my glaucoma patients know very well, and this is the 4th test for glaucoma, it is called the visual field test. Now, the visual field test is really, really important for glaucoma. And that's unfortunate because it is a pretty annoying test to take. And patients that have glaucoma have to take this test 1 to 2 times a year. And for some patients with advanced glaucoma, they may need to even take it more frequently than that. The reason this test is so important is it measures your peripheral vision in a more standardized way than you could ever notice vision loss yourself. So we look at this peripheral vision test to see how your peripheral vision is doing on the treatment that we have you on. So if we see an eye pressure that looks fine, but your visual field seems to be getting worse, that's an indication to the glaucoma doctor that maybe we need to add some medication or do something further. Because remember, an isolated eye pressure in the office is just one reading out of infinite readings that you're gonna have throughout the day and throughout your life. So maybe we happen to be catching your eye pressure at a time where it's maybe on a dip and not when it's peaking. So if you start to see visual field changes, that indicates to us as glaucoma doctors that, hey, maybe there's something else going on here that needs further treatment, meaning needs more pressure lowering. So this is how the visual field test helps us with the eye pressure test, and that's why it's pretty standard to have them both done if you already have glaucoma. It's also very standard to get them done if your nerve looks very suspicious for glaucoma. Now let's talk about the fifth important test for glaucoma, which is something called an OCT. OCT stands for optical coherence tomography. The OCT gives us a very detailed cross-sectional image of the optic nerve and a layer of the eye called the retinal nerve fiber layer. The test measures the thickness of the layers to figure out if there has been any thinning of the RNFL layer from glaucoma. The reason why this test is so important to glaucoma doctors and ophthalmologists is because the OCT can sometimes pick up damage of the optic nerve before it shows up on your visual field test. So this means we can catch glaucoma earlier before it starts to make changes in your actual visual field. Also, sometimes in cases of patients where they really struggle with taking the visual field test, or in young children that we may be monitoring for optic nerve damage, we can sometimes use an OCT to trend their nerve over time and see where they started and where they end up after a year or 2 years. Now, it's important to remember that the OCT is more standardized for adults than it is for children, but in children it can still be a helpful test because not all kids and some adults are not really great at taking the visual field test, which can make it unreliable. The nice thing about the OCT test is that it doesn't really require input from the patient and it's more operator dependent. The sixth test that your ophthalmologist will do is a pupil exam. Now, ophthalmologists will do a pupil exam anyway, just because it is good to assess your pupils. It gives us an overall view of how the eye is doing. But specifically in glaucoma, we use the pupil exam to see if one eye is more affected than the other. What we are looking for is for one pupil to dilate abnormally, and this is called a relative afferent pupillary defect, or an RAPD. When one pupil is more sluggish than the other, it can indicate that that eye is doing a lot worse than the other eye because, like the name mentions, it's a relative defect to the other pupil. It can get tricky when you have advanced glaucoma in both eyes, so maybe both eyes are not doing well, so you may not necessarily see that paradoxical reaction, but still the pupil exam can be very helpful. The seventh glaucoma test is something called a gonioscopy. Now, the gonioscopy is important because it measures the drainage angle of the eye, and this helps us to figure out, is the glaucoma something that's being caused by a structural or anatomic issue, or is it something that's being caused by a problem with drainage a little further in the anatomy? So the reason this is important is these types of glaucomas can be treated differently. If someone has a narrow angle and the fluid has trouble getting out of the eye, a laser procedure may be very helpful for these patients. And if some patients have something called open angle glaucoma, which is actually the more common type of glaucoma, then those patients can be treated with a different type of laser or eye drops. There are also situations where the angle may be somewhere in the middle, and you may want to watch those patients to see how they do and only treat them if their pressure starts to get high or if their optic nerve starts to show signs of damage. And then there are some people who are what we call anatomic narrow angles, which means they have narrow angles, but their optic nerve is doing okay. Now, the option for these patients is also to either watch them very closely or to do a laser to prevent them from going into an acute angle closure attack. Each patient is very unique and very different, so it's always important to talk to your doctor about your specific anatomy, as well as any additional risk factors you may have for optic nerve issues. Now, the eighth test for glaucoma, and probably the least important, which is gonna sound a little interesting to anyone watching, is the central vision. So what's interesting is that central vision actually can remain really good even into advanced stages of glaucoma. This is good in the sense that patients can still see centrally, but it's bad because patients don't notice when they lose peripheral vision. Now, if you have a problem like a cataract or something that affects your vision centrally, you notice that right away. And when you notice something right away, you're more likely to go out and get help and seek care from an eye doctor. This is why glaucoma can be so difficult to diagnose early, because patients have no symptoms. So the central visual acuity, while it can go down in glaucoma, it usually goes down much later in the course of the disease. So typically, a lot of glaucoma patients have good central vision, even if they have moderate to severe glaucoma. However, of course, it's still important that we check your central vision. It's a pretty basic part of the eye exam. But in terms of glaucoma, it doesn't give us that much information. What questions do you have about glaucoma? Be sure to drop them in the comments. And if you found this helpful, remember to hit the subscribe button and share this video with someone else. Thanks for watching, and I'll see you next time.